good boy? Did I cheat enough? Did I cheat too much on not taking the medications?
Tell me what process you used to come to this invention.
Oh, well, we were thinking about this, about, in retina, we put in air bubbles or gas bubbles in people's eyes and to fix retinal detachment. And sometimes we have to see them in the middle of the night because they feel pain, because the gas bubble expanded. And it's an eye emergency, and we do go and see them in the middle of the night. So we wanted people to have an idea so that they could tell us sooner that it's about to happen or whatever, that we could then head it off at the pass so we don't have to either go in at midnight or have the patient suffer. We want them to have a stable pressure. And the other thing is that I see a lot of diabetic patients. They get glaucoma, neovascular glaucoma related to diabetes. And we too want them to feel their pressure so that they know, because many diabetic patients don't take their medications correctly, or they have a big candy bar or a donut and their blood sugar rises, and it can cause changes in their lens size, an immediate change, and that can push all the structures forward and cause pain and angle closure and stuff like that. So I came upon it thinking about this, and then I had 2 patients in 1 year who were in skilled nursing facilities, in geriatric nursing homes, and they were complaining of a painful red eye, and one had surgery, one did not, and no nurse touched them. Nobody called an ophthalmologist till 6 days or 2 weeks later. By that time I saw them, their vision was gone. It was hopeless, and it was very sad because this is America and it could be prevented. And we just did a study where we did a survey of 101 healthcare providers in skilled nursing facilities, in elderly nursing homes, and we found that 49% of the nursing people did not know that what angle closure glaucoma was. So they didn't know that this could happen, that the red eye was associated with it. So this was an eye-opener, because number one, it's not taught in America up to nurses. It is taught in England. So it's very interesting that there's a disparity of worldwide education, even though this is a big problem. And angle closure is preventable, and I was shocked, and I thought, well, we should come up with something, and I toyed with this. It took like a year to get the type of rubber balls, to measure the pressure in the rubber balls, get the manufacturing, and it was a fun process. I learned a lot.
What do you would like to do with this?
We would like to tell everyone that the concept of an eye self-exam. We created a website, and we want people to not be afraid to touch their eyes, and we want them to tell all their friends, because maybe your grandma is stuck at home and she doesn't know about it, your aunt or somebody with amputation, or they're stuck at home wheelchair bound. We have many people like that. We have many disabled people who are kind of lost to health care because they have nobody to take them to the doctor, even though health care is available now. So home health services is still kind of not developed. And in third world nations where glaucoma is still, widely found, India, China, rural China, Africa, there's more cell phones than people knowing about glaucoma. We want people to know about glaucoma. And we think vision is important, certainly to live a life where they can, in a sighted world, it's very important, or some vision. No vision is very bad. So some vision is good. So we want people to go on this website, check it out. They can buy our set, and we're trying to get it manufactured cheaper. We're going to try to fundraise. We're trying to advertise it in our own specialty societies. Our societies we're very lucky in a technological world. In ophthalmology, we can do a 6-minute, 7-minute cataract, really helped blindness in America. But not everybody has access. If you're far away in a farm, if you're handicapped at home, you're homebound. And we want them to still feel that there's a way to test for this. Mm-hmm. We have about 4 minutes remaining. You have some other questions?
I found it very interesting that ethnicity is very tied into glaucoma, and that people of certain ethnicity are more prone to glaucoma. Can you talk about that?
Well, in California, I've been really fortunate to see a very big population of different ethnic groups of Hispanics, Russians, Chinese, Japanese, Koreans, African Americans, and I found that their glaucoma is different, just like what my textbook said. The interesting thing about Asian populations, such as Japanese versus Chinese, that their glaucoma was different. I found that out. And I also found out that the optic nerve changes were very significant, and they could have abnormal optic nerve but not have glaucoma. Yet some people with abnormal optic nerve did. So it was a very hard thing to decide how to make that diagnosis. And people at UC San Francisco, Dr. Shan Lin works on that. He has a large registry of East Asian optic nerves that are abnormal, but not yet glaucoma, or maybe never. And another researcher, Dr. Singh at Stanford, flew to China and found that the glaucoma there was different than the Japanese. So it's very interesting. So we're learning more, and we created a Journal of Asian Health where we discuss that, because there are health disparities among Asia, which are significant.
What about African Americans?
African Americans, there was a big push in the mid-'80s to early '90s about glaucoma in African Americans, and usually they should be seen by age 40 for their first eye pressure check, for somebody to see them. And if any African American in our audience is listening, if their parents or their family members, grandparents, aunts, or uncles have glaucoma, come in, don't wait till age 40. They also can have an abnormal optic nerve like the Asians, and but when they do, they're more predisposed to glaucoma. And when they get glaucoma, it's very fast. The changes are very fast in visual field. So we really need to see more African American awareness of glaucoma, and the glaucoma self-test exam would be very good.
I also found out that babies can get glaucoma.
Yes, congenital glaucoma. We have famous entertainers who had congenital glaucoma. And what happens is that their eye becomes very large, like they're born with very large eyes, or suddenly within the first few years of life it becomes a very large eye. And instead of a white sclera, so instead of this part being white, it's bluish. And that is congenital glaucoma. And some middle schoolers can get it. So it's important to be able to feel comfortable touch your child's eye.
Okay. Well, I'm glad to know that glaucoma is manageable, at least certain types of glaucoma, because so many people are prone to glaucoma, and especially with our aging population. So I'm glad that you've implemented something that we can all use, and that you can distribute and have a worldwide impact.
We want to, when we sell this, if we want to donate a portion of our profits to getting it to the world, to public schools in rural areas, because we feel that education starts young. So anyway, we want to thank you all for joining us, because glaucoma is a big problem in public health. And if you like this show, donate to KSAR TV, Saratoga Access Television. And thank you all for joining.